Welcome to
Yeah.
Cancer Nursing Power Hour, your go-to spot for real talk and real tips in the world of nursing.
So plug in, scrub up, and let's go. This is Pacer Nursing Power Hour, where students get powered up. Oh my God, it got worse. I can't sing, but everyone says don't take it out, and it just gets worse. Like dogs are
I
howling.
should make you do vocal beforehand, like la 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 la.
No, I don't. They would just come in packs then. Fine. I keep trying to stop doing it. God, it's so awful.
Oh, this is gonna be the best. This is gonna be the best. We're 2 seconds
best.
and I already want to pee my pants.
Yeah, I
y'all.
think we peed before
Yeah, we
for
did.
that
I
purpose.
did.
I did that.
We're
This
very
is
open.
I can't say excited. This is there's no words. I'm
The
speechless.
height
Yes.
of like this is the apex of everything we've been doing.
Yeah.
Like it
Yeah.
is unreal
Yes.
to me that you're here.
Yes.
And you
Thank
accept
you.
it and you're here.
Yes.
This is like just it's amazing for me.
So we have Radonda Vaught with us today.
Yeah.
Thank you for joining
We are
us.
so happy.
Y'all,
I'm
I'm just a normal person that people just happen to know about.
Yeah.
That's it.
We of course after we chatted last week, for those that don't know, we chatted with Radonda just like to get to know you a little bit and you get to know us.
and she's our new BFF. I'm
Yeah.
like, she has my phone number. I'm keeping it in my phone number. I know. I'm so excited.
I went home and of course my husband knew about it and he was like, "How did it go?" And I was like, "She's just like a cool
Okay, now
human."
Yeah.
give your husband credit.
I do. This is all because of you, Daniel.
Yes. Thanks,
This is
Daniel.
This is for you.
Yeah, shout out to Daniel. He is the one that gave me the courage to, I think I messaged you through something, I don't know. And it all
And
just
she didn't
snowballed
tell me.
from there.
She didn't tell me she had emailed you.
Yeah, until you had
Until
emailed me
you-
back. And
yeah.
I was like, okay, listen to what a crazy thing I
What
did.
you're leading up for. You don't want to tell anyone
Exactly.
because what if it doesn't happen?
But I
Mhm.
had such a
Yeah.
bad day that day. You remember?
It was.
I'd had-
She was down in the dumps. I was like, well, I have some good news for you.
And I almost
Yeah.
wrecked.
Oh no.
I was so excited. I'm like, hey.
The talk to
Oh
text.
my
I think you actually called me for that one time.
Yeah, I think I did. Yeah.
All right.
So welcome to Pacer Nursing Power Hour, our little
Go-to
nursing
spot.
school go-to
I know.
spot for real tips and real talk, you know?
Yeah.
And I think that is truly what led me to reach out to you because that is what we're passionate about is real talk and
Yes.
real tips in the world of nursing.
Yeah,
you know?
and I think the first thing that I saw a video of you on another podcast or interview, what you have to say is so important for students to hear right now. It just is perfect with our mission for this entire
Mhm.
podcast because it's not just about the education. It's about, like it is education, but still, we
Yeah.
want these nurses to go out.
It's about knowing that you are sending real humans out into the world to do this job. We're not just
Absolutely.
educating you to be a nurse. You are also, this is one of those careers where there is not much separating you as a human from your identity as this career. Like,
That's
so there is
true,
a
though.
very human side of this that you really have to like take care of and nurture. And
Mhm.
that's where the real conversations come in. I
It
agree.
is.
That's very
Yeah.
important.
I think that your being here just is proof positive that when I heard you have so many mic drop moments, you don't know that, but I have them all written down in quotes.
Oh, I love this.
Yes.
She really
What
is
are some of
your
top
She
3?
really is.
Expectation is perfection. You said that. And
In case you didn't know, you said that.
and I
I said that.
tired of telling the truth behind closed doors.
Mhm.
That's the one that literally I just went, holy cow. That's amazing. Absolutely. Absolutely. So
And most nurses who have been around for, 3 or 4 years, like yourself, because you're only 30,
Mhm.
they know this by now. They, They understand what that means to have closed door conversations and then nothing ever happens, or you find yourself on a very different trajectory from what you thought was going to happen as a result of having very candid conversations behind closed doors with important people.
Yeah, absolutely.
Absolutely.
And I love that. So, you've inspired me.
Absolutely,
I
for
mean,
sure.
it's nothing but your ears probably been ringing because my daughter is a new nurse. She just graduated. This is her first week as a nurse job.
Yay!
And so
Same.
talking to you, I immediately said, "All right, Claire, listen to this. Listen to this. Listen to this. Do this. Don't do this. Do this. Listen to this woman." And she's like me. She's like her mama. She's a spitfire. And she's like, "Oh no, I got this." I'm like, "Okay, baby girl, you tell me in a year or so.
Yeah.
Pipe
Yeah.
down." But yeah, so your words carry true for someone like me who's been in this profession for 30 plus years. Keegan's
Mhm.
middle, and then brand new
Brand
nurses
new.
and students. So that just tells me how important it is because it can speak to every level.
Yeah.
Mhm.
Well, I'm excited to ask you probably way too many questions today,
Let's do
and
it.
we have wanted to ask you questions really
Not about the
not about everything that happened necessarily, but the lessons you've learned
Yeah.
and how you can share those learned lessons with others and how we can move forward and progress and do better. Like how can we work together to prevent stuff like this from happening? So I'm really excited to jump into this. Y'all ready?
yeah, rocket. Let's go.
Okay, so I'm just gonna
Do
start
it.
at the top if y'all are good with that. We have
Yeah.
only 12,000 questions. So
I should have brought some wine.
yeah, yeah.
Oh, that's funny. Yeah. Could have had a
So,
I'm not
Radon,
driving.
what part of your identity was hardest to rebuild after the trial? And do you still identify as a nurse?
From a legal standpoint, no, I do not identify as a nurse.
Mhm.
I identify as a former nurse.
Mm,
Okay.
Um, you know, it's you have to be very careful about
Yeah,
something like that, especially because there are lots of people who are asking me to talk about this case. I don't ever
that
want to
makes sense.
represent
Yeah.
myself, right? So, a former nurse, and that's fine. That's where I am now. I'd consider myself more of an advocate.
So
That's
how
where I am as
I guess
far as being able to fulfill an identity.
Mhm.
um, that's my role. My role is to advocate, and I can do that by storytelling, by continuing to be a part of the community of folks who talk about patient safety, who talk about safety in general, who talk about systems, structure, and all those things, which we'll get into, but I
yeah.
identify as an advocate. What part of my identity how
How
did
did
you phrase
you
the question?
rebuild how did you rebuild your identity? Because like you said earlier, nursing's kind of like ingrained in us. Once you get into the field, it's just
Yeah.
kind of part of who you are. How did you transition that to where you are
I
now?
don't think she fully transitioned. She's a former.
People kept telling me, "You're still a nurse, you're still a nurse, you're still a nurse." And I very much took a step back from that in my own head because, I wasn't. I didn't feel like I was. I didn't feel like if I was a nurse, I was a very good nurse. And so it just took a lot of time. You know, um, I think identity is one of those things in life. It's always evolving with us, right? It's changing.
Yeah.
And it can be overwhelming, and it can have a really negative impact when you identify with one thing. You're like, "I am
That's
this,"
true.
right? "I am Claire's mom.
I
I
was
am
gonna
a
say that about
nurse,
motherhood.
Daniel's wife," right?
Yeah.
I and when you put all your eggs in that one basket, then, something happens that crushes that part of you. That's really hard, right? I had a lot of different identities, like hats that I wore, but it crushed a lot of them. It crushed just me, not Redonda as a nurse, just Redonda.
Gotcha.
And it took a hit on all of those. And so it's taken years and it probably will continue to take for the rest of my life. I'll still be figuring out what, what that identity means, but I think it's just living whatever purpose you feel like you can every day. That's how you figure out how to get that back, right?
Right.
What's your purpose? What can you do? And there were a lot of really, really kind and supportive people who helped me along the way to kind of, you know, find that purpose again.
That's awesome that you had a village surrounding you.
So
Man, I did.
we talk a lot about we've had an entire podcast episode on coping and resilience.
Mhm.
Do you feel
Mm.
like there were specific tools that you had in your tool chest per se, you think? Or was it your village that you had
It
around
was
you?
I don't know what gene I was born with that provides me with a high level of resiliency, but it's been there since I was a kid. And you lean on experiences in your life. And if you think about, well, I've gotten through those things, I can get through this too. Things are not going to look the same afterwards, but that doesn't mean there isn't something worth trying to move towards. If nothing else, you just want to move away from the negative stuff and
Yeah.
just find a neutral space. Sometimes just right here is fine.
Right.
We just need to be less over there. And that's kind of how it was, just moving away from that. It took a long time for that to happen. And so that that's kind of where it sat with me for the longest time is that there was no resolution to
Mm,
anything for a
mhm.
very long time. Right.
It
This
was
didn't go
almost
to
5
trial until
years.
yeah, it didn't go to trial until 2022, March of
Right.
2022, and it happened December 26, 2017.
Mhm.
That's a long time to have to
Long
sit
That's
time.
and
insane.
wonder. And so that was hard. That was hard to not you I couldn't go anywhere. I just had to stay
Life was
right
like
there,
pending.
you know,
So that's a important topic right there is so the event happened and you weren't really in a courtroom or anything until 2020, early 2020, right? Your first
until what?
court.
Oh, I lost you for a little bit. Until I didn't go until into court until 2022.
Okay, when were you the arrest? You said you didn't know you needed a
Yeah.
lawyer until you were arrested?
That was early February of 20 late January, early February of 2019.
So
I want to say
Wow.
like the
that's a
first.
long
That's a
time.
long
Yeah.
time.
Yeah,
What
over a year, I think it was 14 months, 13, 14 months.
mm,
Yeah.
so what helped you like, how did you know what was happening or, obviously looking Monday morning quarterbacking, that's my new phrase for the sake of looking back,
Mhm.
if you had to tell someone, what was going through your mind, like, right then?
When
You were that during the before you were arrested,
mhm.
after the event? Like, what would you tell a young nurse if they didn't meet a standard of practice and they knew they were
Well,
terminated?
I'll tell you actually what I told a young nurse
Okay.
Okay.
because, so it took me 6 months to even apply for jobs. I could not even think about going back to work, and that was all because of my husband. He was like, "You have to get back on the horse.
Mhm.
Because
You
I was
ha"
about to say 6 months seems like a short period of
I
time to
know.
me.
Oh, I mean, I was just I was depressed. I was
Yeah.
depressed. I was crying every day. Both of my grandmothers had died within, like,
Oh my
a
god.
very short amount of time after Miss Murphy passed away. I also watched one of my childhood best friends bury her 20-year-old baby brother
Ugh.
who got who got hit trying to drive to work on his motorcycle by a work van who didn't see him and pulled out,
Oh
um,
my gosh.
killed instantly, and along with a really good friend of mine who I'd worked with who died of ALS the day after I was terminated.
Oh my
There
gosh.
was just death after death after death, so I
That's
was not in a great
a
place.
dark
Yeah.
time.
Yeah, um, and so I just sat in that, and he was very encouraging, like, he's, different from me, but he's like, "They're there," like,
Yeah.
He was supportive in the best way he knew how, which was to
Right.
encourage me to get up out of this space and go somewhere and do something. He believes that I am this amazing person. He just thinks that I'm the best at everything, that I'm so smart and so wonderful. And it's really nice to have someone in your life that believes in you that much when you
Mhm.
don't believe in yourself.
Yeah.
So 6 months, I went back to work. I was working at, HCA's Centennial Hospital in Nashville. I
Mhm.
went to work in the CVICU, and it was I think I was hired in June, end of May, beginning of June, and it must have been, I don't know, 4 or 5, 6 months into that, probably fall timeframe, I would say, 4 or 5 months into that.
Mhm.
I come in on night shift to get report, and a new nurse that was orienting still was giving me report, and I'd worked with her, several times, so I knew who she was, and she was really upset. And she was trying to give me report, and she was telling me how she had, on an open heart patient when they'd come out, she had hung one thing instead of another. Um, they caught it pretty quickly and were able to correct. No harm come to the patient, within 5 minutes of having initiated this drip. They caught it, fixed
Mhm.
everything, but she really took that. I mean, that was hours before we got report. And
Really internalize that.
she was really, you know, she really internalized just how much harm could have happened
Right.
Mhm.
to that person, and that she would have, you know, been responsible because it's your job to check the medications and all these things, right? And so I remember sitting there with her, and I had not told really anyone outside of a very close circle of people. Certainly hadn't told anyone that I worked with at that job about this. But I sat down with her and I said, "You know what? You learned a very valuable lesson today.
Wow.
You learned a very valuable lesson today, and nothing bad happened.
Mm.
The price of that lesson was very, very inexpensive.
Mm.
It was very low. And I guarantee you, I can see how impacted you are by this. You know what? There's nothing that anyone else needs to say to you.
Mhm.
This lives now, rent free, in your head forever. And
Yeah.
this will walk with you in all of your paths. You will never forget this moment,
Mhm. Mhm.
right?
Yep.
This is going to make you a better nurse. No one is perfect and everyone makes mistakes." And she was just really sitting with it. And I said, "Let's take 5 minutes. I would like to tell you something." And I told her, as, you know, collectively and briefly as I could, that I was like, "I made a really bad mistake. I made a bad med error. So bad that it cost someone their life.
Mhm.
I understand what you're feeling right now, and I just want you to know that I'm not comparing your experience to mine, but you get to walk away from this
Mhm.
with just
Ah,
the lesson."
getting
Mhm.
chilly
And
bumps.
that's such an important lesson, right? It's such an important lesson.
Yeah.
And nothing bad happened.
Yeah.
Mhm.
It's okay. You are not perfect. Neither am I. No one is perfect. If you're doing the best you can, that's really all we can ask,
Yeah.
right?
That's
It
true.
would be great to say that we could all be perfect and that we would never make mistakes. We just don't have the luxury of
Mhm.
doing that.
Mhm.
But we do have the ability to learn from those things. And beating someone down when they already feel terrible about something,
Is
that
not
doesn't help at
Not
all.
gonna help.
good.
Yeah.
Mhm.
Not
It's
gonna
sitting
help.
with that person and saying, "You know what? I see where you are.
Yeah.
I have been where you are, and I know what this feels like. And
Yeah.
I'm so sorry because it's going to take you a little bit. You're shook,
Right.
clearly shook. That's okay. Take your time, process it, and just know that what you've learned is only going to serve to make you a better nurse. It
Yeah,
Yeah.
doesn't make you a
absolutely.
bad nurse. It doesn't make you a failure as a nurse. Doesn't mean you should up and quit. Nothing bad happened. And the majority of errors, that's exactly the outcome.
Yeah.
Yeah.
Bad happens. Nurses make mistakes all the time. All people in healthcare make mistakes all the
Mhm.
time because we're human.
Yeah,
Well,
Most of
absolutely.
the time, nothing bad happens, right? And it just makes us stronger and it sharpens that skill set. That spidey
Absolutely.
sense. It's like something's not quite right here. Let me double check.
right.
I
Yeah.
bet her medication practice to this day is nearly
Yeah, I bet she's
flawless.
double
After I
checking.
got arrested and everyone knew who I was, she sent me a very nice care package with a card. And
Aw,
I was about
she
to say, I'm sure that 5 minutes
meant a
changed
lot.
yeah,
your
she was
Yeah.
like, "I will never forget, us sitting down and, being in that moment
Mhm.
and how that felt, and you taking the time to just sit and talk with me." And, it it lifted her up in that moment where she felt
Right.
really bad about something. And again, thankfully, nothing bad happened to the patient.
Yeah.
Exactly.
And we could just sit with that and move forward, right? And yeah. So that's what I would tell them is you're going to make mistakes. It's not a free for all to say, well, I'm just going to make a mistake. It's just going to happen and it's going to catch you off guard.
Mm.
You're not going to be ready for it, right?
Yeah, that's
But when
true.
it does happen, sit with it and just understand that every it's an opportunity for you to learn and be better. It's
Mhm.
called a practice.
Right. Oh, that's a good point. Good point.
That's a really good
Valid.
point. A serious mic
There's
drop,
another quote
Sauce.
to add to your
I
list,
know.
Kennedy.
I know. I'm adding.
Add it to the list.
I'm
So,
adding.
knowing things like, yes, medication errors happen. It happens a lot more probably than what we think.
Mhm.
Knowing everything you went through your experience, and just from the brief amount of time that we've chatted, you've shared so much knowledge with us in such a
Mhm.
short amount of time. I can't even imagine everything that you learned throughout your experience. But how has all of that knowledge changed your trust in the healthcare system we have?
You know, I'm I'm pretty naive when it comes to those kinds of things. I am a very trusting person.
That's me.
I
It's
just
like
wanna look at everyone and everything and see the best in them.
Yeah.
I
absolute.
wanna look at that person whose eyeballs twitching at me and be like, "They're just
You're
having a
good at
bad
that.
day. They're just having a bad day. Hey, here, come here, let's sit down, have a snack. Tell me what's going on." Right? Like, I wanna believe that everyone has the best of intentions.
Mhm.
Absolutely.
Um,
I get scammed all the time because of that belief. I fall into stuff because I believe people.
yeah.
I
Well,
wanna believe that people are all honest.
this is this has taught me to approach my reality and to approach my understanding of things with, just more curiosity than anything, right? I don't want to approach it from, "I think that you're doing something bad,"
Right.
or
That makes sense.
judgmental. I wanna approach it from a curiosity standpoint because I do believe that most people in healthcare think that they're making the best decisions.
Mhm.
They think they're making decisions that are good, that are not gonna have, negative impacts. And I think there's a large disconnect from the people doing the work to the people that are making some really top heavy decisions in our
Sure.
hospitals.
There
There's a
is.
big disconnect there,
Mhm.
and that lack of understanding about the current environment is like and the what it actually takes to be the person doing the work to get the work done. There's a very different expectation of what that looks like up here
Mhm.
Yeah.
versus the reality of actually getting the work done
Yeah.
and getting it done safely and
Yeah.
just getting it done, period, sometimes. Um, I think that's an area where it seems like the mistrust can come from. It seems like we think that everyone is making this really bad decision or that they're being greedy or selfish or, they don't have an understanding. And that's on them, right, to gather some more information and to be curious. They can take that same approach. I don't think that healthcare is very good at doing that. It's so big and it's so complex.
It
It
is.
really
And
is.
so
It
that's a problem for us as an industry, as a workforce and as an industry. We also really have to stop with this whole sort of like empathy manipulation kind of thing as nurses, that we just have to go in and like get the things done and, no matter what, cut all the corners, take the risks, etc. Because I have to do it. And if I don't do it, no one else is going to come in and do it. This is a business.
Yeah, you're right.
Healthcare is a business. You are going to and from work. That's a business. That is your way of earning an income. Don't confuse that with this is who I am and I just have to I have to be all in it to the point where you forget that it's just a business at the end of the day.
Are you feeling really uncomfortable right now?
No, I'm feeling we
This is
just talked about this last week. We were talking about where is the line between patient advocacy and your
like you
your
projecting your own thoughts, you know?
Yeah.
like with the empathy, like you bring that like at
You
what
can bring that to the patient all
yeah,
day. I'm not saying don't bring that to the patient. What I'm saying is don't fall victim to the business,
Yeah.
right, right,
Oh
right.
no. So
right?
a couple
When
episodes
someone
ago.
calls you and says, "I know you work 3 shifts in a row, but I really need you to come in for 4." We
That
don't have anybody else.
yep, that.
She's
I'm
agreeing with you
so
now. I'm gonna
sorry
call
that
her
you
out.
don't have anyone else, but your failure to staff the facility with a backup plan does not constitute an emergency on my part to come
Mhm.
in when I'm tired and I have things to do in my life.
Mhm.
Maybe I just need to sit and binge watch The
His
Real
and hers.
Housewives.
Yeah, yeah, yeah.
Let my brain just
Season
marinate in
pass.
Okay.
trash because that's what you need. It doesn't matter. What you need is what you need. Don't do things that are unsafe because the hospital is pulling you in
They don't
because
care.
because
They're
because it's
yeah,
about the patient. Who's going to take care of the patients?
right.
I
Yeah.
don't know. You're not the manager.
Yeah. You're the nurse.
And it's not your problem. And
Mhm.
if you fall victim to that mentality, you'll never get out of it. It
No.
will always be your problem. You will always make it your problem. And when you make other people's problems your problems, that is a recipe for disaster
Yeah.
on
I
your own behalf.
I
Your
am
life will crumble in front of you.
yeah, we harp on our we beg our new grads, don't work
5 in a
more
row, 6 in a row.
yeah,
Like,
don't
don't do
do
that to
that.
yourself.
I know the money may seem great, but it's not worth your mental health.
It
Mhm.
is not worth your
And
mental.
you
Look
after
at
the
look
3rd
at
shift,
Chicks
you
and Kate.
become unsafe.
Right? It's not safe. I have advice for new graduates, and I know that was one of your questions, so
Yes,
Mhm.
I
Yeah, give it. You can give it. Go ahead.
they've
okay.
been waiting for this.
I tell them first and foremost, if you're gonna pick whatever you're gonna do, right? If you want to go to the ER, fine, go to the ER. If you want to go to the critical care, fine, go to the critical care. Pick what you want to do. Stay there for a year.
Okay.
Stay there for a year.
Okay.
Okay? Be
12
good at
months.
doing that thing. No overtime for the first year.
Okay,
And
good.
do not work more than 3 shifts in a row.
Okay.
I think it should be law.
I
I
mean,
mean,
it's just a
I think that I would love to see institutions make that a policy for their new graduates.
yeah,
It's
especially for
just
that
not
first year.
safe.
It's so much.
Right. I also don't think that you should be floating to another unit. I have a whole idea about what
Questions.
it looks like. Listen, this these are real life learned lessons, okay?
Yes.
Yeah.
And my nursing career was pretty short, y'all. When this mistake happened, let me just remind folks,
Mhm.
I only had been licensed for about 3 years.
Mhm.
I'd been at Vanderbilt for 2 years and 2 months. Prior to that, I was at a smaller regional facility for about 9 months.
Mhm.
During that 9 months, I could have written an entire book on the lessons I learned there.
Were you put in a leadership position really quickly?
Oh,
We're seeing that a
no.
lot lately.
So because I graduated nursing school when I was 30. Okay, so I was older than the average
Non-traditional, yeah.
22-year-old graduate. So I presented myself with a slightly, you know,
Right.
more mature
Mhm.
version of a human. Not saying that's a bad thing. It's just I wasn't
Your
20.
brain is fully formed and grown.
Yeah.
I was 31, okay? And I went into this from a mindset of, I thought about things a little differently. So the day I got off of orientation, I got floated to our critical care unit.
Stop it.
I kid you not. I got floated to our critical care unit, and then
Stop.
over the I said, I don't know what, like, I'm literally brand new off of orientation, and I don't know if they thought that that was like, "Oh, you're new off of orientation. You're new here," or "You're a new nurse." I don't know what they thought, and they were like, "It's okay, we'll give you easy patients." They gave me someone who had, like, esophageal varices, a lady on an insulin drip, and I don't remember what the third one was.
In the ICU.
No one was on a vent.
No one was vented, but aren't those the ones you want in the ICU?
Kind of. Kind of,
I've never worked in the ICU, so that may be, like, an offensive question, but, like
We're ER, and
I
she
didn't know what I want. Oh, yeah, you guys get that vet. The vets, you're like,
yeah, you're out of here. When you start
yeah,
talking, you're moving.
mm-mm.
Yeah, so
I
that
still can't even close my mouth.
thank you for reminding us
Well,
that you were
let me
still
build on that.
Yeah.
Yeah.
They kept floating me back up there. And after about, I don't know, 3 months or so of, being floated back up there, the charge nurse was like, "Hey, you should, like, we have some openings. You should transfer to here." And I said,
Pretty much work here anyways.
"Look, I know that I look like I'm a little bit older than your average nurse here, but I don't even have 6 months of nursing experience." And she said, "You
Oh,
ready
no,
for
you're
this?"
leaning in. You're leaning in.
She said, "It's okay. Neither does anybody else."
I can't.
And I said, "And
Mm-mm.
that is exactly why I will not be transferring here. Because if you think that when someone is crashing and burning, I want to ask someone with the same or less nursing experience and a decade less life experience what to do, you are sadly mistaken. No, thank you. I will
Oh
stay
my goodness.
here on my trashy med-surg floor where I get all these intractable abdominal pains from the emergency department and the diabetic toes that just keep falling off and the UTI grandmothers from the nursing home. I will stay over there. No, thank you.
Oh my gosh. Okay,
It was a mess.
that is I feel like
Don't
this
float.
angels have sung.
Yeah,
Yes.
seriously, like,
No
that should
floating.
be
If you're gonna float,
highlighted, underlined,
right.
circled.
We can say this all the time, but
Let
you
me
were
add to that. But so here's the thing. The reality is I can sit here and say, don't do it. You can tell your students don't do it. But the reality is someone's going to do it. They're
Mhm.
going to get manipulated into doing it.
Yeah.
So here's how you do it safely. You say, you know what? No, I'm not going to float to the critical care unit and take assignments.
Okay.
What I will do, if you need the extra help, is I will float up there and you can delegate tasks to me that you would do for a patient care tech.
There you go.
Yeah.
I can help you move your patients. I can help you answer call lights. I can help you pass certain medications that I feel comfortable with. I can help you with those tasks, but I will not be taking a patient assignment. And you
Yeah.
have to remember, you own your nursing license,
Yeah.
not
Yeah.
the hospital, nobody else. That license has your name on it.
Mhm.
Yours.
And
And no one can tell you that you have to do something. They can't tell you that you're abandoning something that you haven't taken an assignment on yet. Okay?
Mhm.
You can dictate that. You can negotiate in good faith. This is not a dictatorship. You can
Yeah.
say, no, I'm not comfortable with taking those assignments, but I am happy to help. I
Sure.
think I have a solution that would work. I will go up and I will be a care tech.
Yeah.
I will help out. I will offer assistance, but I will not be taking assignments on patients that I'm not trained to care for in a unit that I'm not familiar with, that I haven't been oriented to, that I don't know the documentation and the charting policies and procedures on, that I don't know the communication flow and who to call when shit hits the fan.
Mhm.
No, thank you. That is a recipe for disaster. Go and be helpful. You can still do that, but you don't have to take those assignments. Or you can say, you know what? I'm happy to stay here. I can help around here. Maybe someone else with more experience should go and do this.
Yeah.
Right?
Yeah.
That's just happening more and more because
and
of
it's happening more and more. I
our
would love
environment right
if
now.
hospitals set up sister units. Right,
Mhm.
and this
Yeah.
is how Vanderbilt did it. So our ICU critical care unit, our sister unit was the trauma ICU because trauma and neuro had a lot of, we shared a lot of patients. So
Right.
if you had to float to an ICU, it was only going to be trauma and vice versa.
Mhm.
I only got floated once, I think. Um, and also if the neuro floors, like outside of ICU and step down, if the floors that were taking care of neurology patients needed help, we could float to them.
So
We could
lesser
support
qua
them
yeah.
with our own knowledge and be able to take those patients. So we floated strategically, right? So
Right.
that there was specific cross training and a specific plan in place where if you knew you weren't just going to go float to labor and delivery and be put in charge,
Yeah. I mean, and all those
see if that happened.
Are
yeah.
you serious?
I am not kidding you.
Wait, what?
Redonda.
What?
They
Not
wanted
kidding.
you to go charge L&D.
This was like this was like
Oh my
This was like 6 months into working this first job that I had. They floated me
That is
to
wild.
the postpartum ladies, and made me the charge because I was an RN, and they sent an LPN from the ortho floor who still wore her solid white scrubs, and they were just as solid white as her head of hair, and she had to have been in her late 60s, and she said, "I don't know what to do. I never touched a
I don't
pregnant."
know how to check the cervix.
Yeah,
I don't know how to palpate I don't know how to check is your fundus boggy?
that's all I remember about maternal health. She
Boggy
teaches it.
fundus.
Boggy
Boggy
f yeah, yeah.
fundus.
I
I
And I said,
Oh my
"Girl, me neither.
gosh.
Me neither. It's just the blind leading the blind over here. It's
Wow.
just the blind leading the blind over here. It's
it
fine."
well,
And then they left us, and do you know who came to replace us the next morning?
Oh, no.
I'm
Nobody.
scared to ask.
No,
Nobody?
nobody. Mm-mm. Nobody. I said, "I ain't even been charged on my own floor. I don't know what I'm supposed to do." I called the house supervisor at like 3 o'clock in the morning. I said, "What am I supposed to do?
There's nobody
What is
coming.
my role here? I've never been charged. What am I sup what is someone who's coming in? What do I need to give them? Are there reports I need to do? I don't know what I'm supposed to do with this. How am I supposed to make the assignment? Is it the same? Do I just hand it
Yeah.
over to somebody else?" And she was like, "Oh, we'll come around and, like, I'll give you all that information, between before now and shift change."
I don't know whether
He
to
got
laugh or
sick,
cry. Like, I think
left.
I'm
The
laughing out of
house
nerves here.
supervisor got sick and left. The day shift supervisor came on. No one communicated anything to me. 7:15 rolled around. No one was
Right.
there.
Guys,
I called the house
I'm here.
supervisor when a traveler walked in and she said, "I got called in. I don't know where I'm supposed to be. Maybe this is supposed to be here." So I called the house supervisor and I said, "Hey, this person's standing in front of me. She wants to know if she's supposed to be here." And that woman had the audacity to ask me why it was that I thought I needed to know.
Oh, stop.
And I changed my tone and really quickly let her know, "This is why I need to know
Only in healthcare.
because of all this." And no one come and told me anything. And I said, "And I'm pretty sure that I can't leave until someone else is here. And
Yeah.
unless you
I
plan
do
on
remember
coming
that.
and taking care of all 10 or 12 of these patients, then yes, you do need to tell me if this woman is supposed to be here. And you also need to tell me when the other person is showing up. Because if I leave, that's patient abandonment, right? And I don't think you're coming to save me."
Yep.
So, oh, and then I was out of there by 9:30 that morning. And then I went to my manager's office and I let her have an earful. And I said, "Don't you ever let
Look.
that happen to me again. I won't ever let that happen to me again. But
But
you
don't
should
even
know.
put me in that position.
How
You
big
should
was
know
this
what's happening
facility?
on night shift when you're not here."
Exactly. How
Right.
big
And
was
that
this facility?
what's that?
How big was this facility?
This had, bed size, I don't know, maybe 200-300 beds.
Okay, so I mean,
A
that's
good enough size. I mean, they had 6 floors plus a
Yeah,
pediatric unit that sometimes opened, plus
sounds
our
good.
unit, which was like the redheaded stepchild in the old part of the building
yeah, we
that you couldn't
there's
really
always
navigate to because we didn't really belong in the new part of the hospital. And then like an Alzheimer's unit that was contracted out by someone else.
gotcha.
So it was
So
a well,
decent size where there should be processes already in place for things like that.
Yeah,
I mean, that
but
a
clearly
hospital
not
doesn't
followed.
suddenly just have those
Right.
circumstances.
And here's the other thing, it's the culture.
Absolutely,
Mhm.
we've just got done talking about that.
People think it's okay to do that. They think
Mhm.
it's okay to do that to young nurses because it got done to them. Well, guess what? 2 wrongs don't make a right, and I'm real sorry that that happened to you. That is a shame that that happened to you. That is a shame that that's how your orientation process went. That is a shame that someone put you in that unsafe position, but it does not mean that we should continue to do those things to the future generations of nursing, because they
Absolutely.
are leaving just as fast as y'all are.
Oh,
Heck yeah.
yes. That's the truth.
Yep.
They are in and out.
You've mentioned several stories, and of course, we know your big story. When we really started talking frequently about your story, we just kept saying the perfect storm, the perfect storm.
Like, if we tried to recreate these events, we couldn't. Maria, epic launch, like the day after Christmas, skeletal staff.
My question though is, this truly happens all the time. So how
Mistakes
can
happen
a
all the
new grad nurse avoid really not a perfect storm, kinda just daily
Life,
life
life.
as an RN?
Well, I can tell you, so there were points along the way where, yes, there were perfect storm elements that were far out of my sight, out of my control, wasn't
Right.
aware of. Lots of those contributing factors that I was not aware of at the moment. In the moment, there were certainly things that I could have had control over, and I could have listened to my gut. And that's what I would tell you as a new nurse,
Yep,
right?
that's your
I
quote.
didn't I wasn't quite tuned in, right,
Mhm.
to that, like, I kinda have this gut feeling, and someone said I didn't need to take the cardiac monitor downstairs, but I think I'm just gonna do it anyway, right? I
Yep.
can make that decision for myself. I
Mhm,
took their word for it after having asked once or twice.
mhm.
I could have just taken the monitor down with m I could have just taken the monitor down and stayed. I asked about those things. I could have just done that on my own, right? It's the little things like that that kind of bug you or sit with you, and
Mhm.
you're like,
Right.
right?
Glad you listen. Glad you
When you
listen to
when
yourself.
you get those feelings, listen to yourself,
Mhm.
right? And just trust that. Look, what's the worst thing that's gonna happen? I got a monitor and I stayed down there,
Right.
and the next guy didn't get his swallow study for an hour later. Big deal,
Right.
right? It's not a big deal.
Mhm.
I could have easily done that had
Absolutely.
I listened to my gut. So I would say listen to your gut, because you're not gonna build those. I mean, it's gonna take you like 3 to 5 years to really get a good footing underneath you to be able to catch those things. And I
Mhm.
would say, 10 years really is where you're like the eyeballs in the back of your head. You're like, "I see you hanging the wrong drip back there." You know, you just
We were
you
talking
I
about
love
that
that you
take
said
so
that.
long to pick up on things, and things change so quickly, so it is also hard to build that knowledge and that skill set
yeah,
of
yeah.
looking for routine and pattern in an environment of complex work that's constantly changing.
That's a great point.
Mhm.
Listening to your gut. If something just doesn't feel right, there is nothing wrong with stopping what you're doing,
Calling a timeout.
calling a timeout and saying, "Hold on just a minute. I just need to double check this. I just need
Right.
to make sure I got the right thing here. I just need to make sure I'm doing the right thing here." And if anyone makes you feel bad about that,
Shame on them.
Right.
shame on them. I'm sure you would rather me double check than someone be dead,
Exactly.
Mhm.
Amen.
right? Because that's what's at stake. That's what's
I'm
at stake,
busy.
Did you
Okay.
You're
right?
excited.
Okay. I have to ask this one question. You're
Oh,
hitting on.
she's going rogue. She's going rogue. Everybody,
Yeah,
she's going rogue.
it's scary. Katie makes me stay to the script a lot because I'm like a squirrel. I am self-diagnosed untreated ADD. Um,
Join the club, friend.
I know, like awesome. So you brought up a great point. You were 3 years out.
Yeah.
And I also had, researched and found that you had said that you had previously precepted a number of new
Mhm.
graduates at that point in your career.
I have
Did you feel now I think, again, going back, you're not being the traditional student and hearing your integrity, you had a lot of moral courage to speak up, to say things, to own it. Whereas I don't think a lot of students and a lot of new nurses have that courage.
Yep.
We were sharing stories last week where I remember, being about that age of a nurse. And I was being precepted, and my preceptor used the same catheter trying to cath a baby, and I knew it was wrong, but I didn't say it.
Yeah.
How would you what would you do to encourage, like, building that? I mean, it's so hard to put into words to ask a
Yeah, like,
question
how
because
what would
Yeah.
you tell a new nurse if they're in that situation? What would you recommend them doing?
Look, if someone's setting a bad example and you know that's the wrong thing to do, if I could see how it'd be very uncomfortable to stop someone and say, you know,
you might wanna use sterile technique.
That's
Yeah.
not how I learned it in class.
Yeah.
you can ask, "Oh, are you gonna use that again?"
Yeah.
Right?
Red
And
flag, yeah. I
they're
want
they're they're allowed their response. You can't control their actions,
Mhm.
but what you can control is what you do.
Exactly.
Sometimes every example you see is not the best example.
It's
There
probably an example of what not
are
to do.
lots of workarounds. Work as designed, work as taught is not the same as work in real life. And you're gonna see people cut corners. You're gonna see people deviate from what the checklist should look like. You're
Mhm.
gonna see people step away from the flow of the process. You're gonna see them bypass certain safety things.
Yep. I
The
always say we're the biggest MacGyvers, and I don't know, do you know
I
who
think yes! Oh my god, yes. Like, look, give me zip ties and
these
ratchet
young
straps.
these
Nope,
young
no, no,
students
I
don't know who
get it.
that is, but
No.
we're really good about creating
Nurses are
workarounds.
great at working around. You know why?
Problems.
Because someone's gotta get the job done, and it's back there he goes, it goes back to that empathy manipulation that I just have to get the job done, and you're dealing with generations of nurses from the past, so you have to have some cultural and generational competency here to say,
Mhm.
"Things are this way because they've always been this way, and here's why." So
Mhm.
here's where I need to navigate between those generational and cultural differences with some understanding about why they're happening and also with the knowledge and the skills that says, like, I can't change that, but I also don't have to do that. Okay. And if it's a problem, maybe you bring it to someone's attention.
Mhm.
It's not tattletaling. It's just as easy as saying, hey, I was curious why you maybe used that twice.
Mhm.
Like, is that something that is normal? Is it because you don't have enough of these catheters to be able to go and grab another one? Is there not another one available? Sometimes those are the realities,
Mhm.
but you
Mhm.
don't know until you get curious about it and ask a little more information.
I love what you say
If
about curiosity, I love that.
Be curious,
Yeah.
right? Ask.
Mhm.
Mhm.
If someone makes you feel bad about it, that's on them.
Yeah.
That's not on you for asking, okay? And if you see things that are happening when you're like, this is something I don't feel comfortable with. You're going to have to discern how you go about letting the people know that have the ability to influence that change, right?
Mm.
If you see a process that's getting broken over and over and over again, and you're like, this could set me up to fail because I don't know well enough to know what's going to happen if I avoid that safety process. These other nurses have 10 or 15 years of experience, and maybe they can catch it because they probably operated for years without it. But it's in place for a reason,
Mhm.
Mm.
probably because something bad happened, right?
Laws are made for one stupid person.
Right? One stupid person. Here
Mhm.
you go. Right? We got all kinds of new rules made because of me. Because of every time somebody does something, we try to make more rules and we try to contain the work. We try to make it safer. Sometimes they're dumb rules. Sometimes they're rules that don't apply at all. You can't you can't fix that, but you can give that information to the people who can.
You know
Yeah.
You
what?
can put in an incident report and say, "Hey, I'm not able to do this. Are you aware that no one on the unit is able to do this process
Yeah.
because of this? I'm
Yeah.
just making you aware because I don't feel safe doing
Doing
it
it.
like this," right?
Mhm.
So,
Those people don't know to fix it if they don't know that it's happening.
but here's what blew me away, Redonda. when I read in the CMS report, I read all 56 pages. Uh, the one of the pharmacists, when interviewed when CMS went to Vanderbilt to investigate for that 8 days, he he actually said, "This is a common workaround." Like,
Mhm.
admitted that it was a common workaround.
The
That
thing
blows
the
my
sad
mind.
thing about the override was that it wasn't even just a workaround. I don't remember if we had this conversation, but it wasn't just a workaround. It was a design.
Right, it 'cause you were
We
having
couldn't it was in order to obtain IV fluids, it was designed our system was designed for you to press override. That
yes,
wasn't a workaround. That was the rule. That was not the exception to the rule. That was the rule. If you needed IV fluids, you hit override, and then you went to the cabinet and you got your fluids.
Which
If you
happens
needed
all the time.
Ativan, you had to go override to get the key and then override to put the key back to get in the fridge, like 3 overrides just for
yeah,
that, for Ativan. If you had patient-specific medication that wasn't stocked on your unit, which you're in a neuro ICU with all kinds of weird random things, lots of seizure drugs. Yes, lots of, probably once a shift at least, you're going to have to access that drawer.
Clicking that
That
button.
was the design.
the confirmation bias. You just hit
It's not the confirmation bias. It's people who don't understand. They think, "Oh, that's a common workaround." That's not a workaround.
that's a
That's what
process
we
issue.
That's
do.
a process. That's a
That
process that is being done as designed by
So that
someone above. That's
they
how
were
it's
very well
designed.
aware of it.
And then you add on. That was the rule. That was the rule. That was the rule. All of those 3 examples were rules, and then you had the exception to the rule. And do you see how
yeah.
do you
Yeah.
see how the perceived risk
Mm,
for overriding
Seemed
just
low.
decreases every
Yeah.
day?
that's a very
I'm
good point.
desensitized to it. It's like alarm fatigue, right?
Yeah.
And
Alarm
when
fatigue,
I
you were just talking
when
about.
we tried to bring these concepts up to the district attorney, they just laughed it off. They laughed off everything. This to them, it didn't click, right? But to nurses, it clicked. So when you say like, yeah, these kinds of things happen all the day, it's
Regularly.
because we see the differences in the way we have to make, and you feel compelled, you feel like you had to make that choice to get the work done. I
Mhm.
felt like I had to make that choice to get that patient her medicine because I felt like if I couldn't get it to her in a quick enough time, the 45-minute to an hour window was going to pass. She wasn't going to be able to get her PET scan that day, and it was going to delay her discharge planning. They needed the results of the PET scan to do her discharge planning. It was already the day after the Christmas, and they wanted to try to get her home. So I'm
Right.
like, I'm going to delay her for another day if I can't get this stupid medicine. And it's
Go,
already
go,
been
go.
15 minutes since I got the phone call about it, and I still don't know where the heck I'm going.
Yeah, that was
And I gotta tag this other fella along with me, and we gotta navigate, and then I gotta make sure he's got everything he needs before we go into this other thing. And I felt the pressure that
yeah,
Yeah.
absolutely.
it was on me. I was the one that needed to be able to help this patient,
Well, that leads
right?
me to my next question. If you could change the med administration process,
I'm getting
what
off
would you recommend is like the top priority? What's the first thing you would change about that?
the med administration process.
Mhm. I know it's probably a lot, but
It's a lot. It is a lot. Barcode scanning is great. Barcode scanning is super helpful. And until I think you and I had this conversation that I
Mhm.
did not know why radiology didn't have barcode scanning
Oh,
for
yeah, because 'cause they're lead lined.
Yeah,
Yeah.
I was like, "Oh, well, that
that
makes
makes sense.
sense." But, in all the years that I've been talking to people about this and how certain areas of the hospital are hotspots for errors, and IR is one of them,
Yep.
no one has ever brought that up as, "Oh, well, this is the reason why." And here's what I mean by information is powerful.
Mhm.
Tell the nurses that they'll find a way to make it work.
Right, we'll fix it.
We'll fix it. We'll design a new
It's common
system.
knowledge.
We'll design something else, right? Like,
Absolutely.
we'll be innovators and we'll fix it. there are so many things that can contribute to an error happening. It's
Mhm.
really hard to say that I could pinpoint something about that process
Yeah.
that I could change because administering medications is so different across
Right.
different levels of care to different types of patients. The biggest thing I can say is just you as a nurse, slow down and take your time.
Slow
Right.
down. That's a big one.
Slow down and take your time. That is within your control. You can't control if you're paper charting. You can't control if you're in a upside down blender flying in the air and it's dark
Mhm.
at night. You can't control those things. You can only control what you can do,
Yeah.
and what you can do is to just for a moment focus on that thing.
Right.
So
Slow down and focus on that thing when you
what
have
would you say?
high priority tasks.
Sorry.
It's
What
okay.
would you there's a little lag, sorry. What would you say that, are early warning signs that maybe you would know that there's an issue, but leadership's not paying attention? What could what would that look like? Am I making sense? I'm not making sense. I don't feel like I am. I don't.
I think you're just not making sense in your own head. Which one are you reading?
Oh, yeah, the early warning signs that a workplace is unsafe and
Oh,
leadership doesn't do.
early warning signs that a workplace is unsafe, like for new nurses?
Yeah,
Great. What's your turnover rate like?
yeah. I
Yeah.
always
Right.
say if that
I
bonus
wanna
is
know I
huge,
wanna know what your turnover rate is like. I wanna look around your unit, and I wanna see more than just 25-year-olds working there,
I love that.
Yeah.
right? How long has like, that person that's in charge, how long have they been here? That
Good
person that's
question.
on night shift that's in charge,
How long's she
how
been
long
here?
have they been here?
Yep.
Students, listen to this right now.
How many patients on average are you taking? Do you have patient care techs or CNAs there to help do some of those heavy tasks to allow you to take 6, 7, 8 patients if that's what they're
Mhm.
going to give you?
Mhm.
Okay. Eh, These are staffing alone will tell you everything you need to know
Absolutely.
about that. And look, ask around. The internet is for free.
Oh,
Okay.
yeah.
You can
True.
take people's word with a grain of salt, try to be educated about it and be professional. But places, if it walks like a duck and it talks like a duck and it
It's a duh.
floats like a duck,
It's
then
yeah.
right. And
I always say bonuses.
I mean, yeah, if they're offering,
A 30 grand bonus, there's a reason.
right, if they're offering a big sign-on bonus, there's probably a reason. There's
Yeah.
probably a reason, right? Because they're having a hard time retaining. What percentage of travelers are
Mm.
staffing your hospital?
Good one. Good
It's all
question.
all of those questions that I can think of about how to determine the quality of your unit would be related to staffing. Now, I can't go pool a
Right.
bunch of questions to the patients and ask them, "Hey, how's your care here?" Back again.
That kind of stuff you
Um,
can pretty much find online. I mean,
but you can find that online too,
you can find
right?
Yeah,
reviews
patient
and stuff
satisfaction.
for
Yeah,
sure.
and so here's the thing, you have to use that information, and we don't all have the luxury of saying, "I wanna go work at the Vanderbilts of the world." We don't all have the luxury of having a hospital like that anywhere near us. You might have an ADN, you might have an LPN. Vanderbilts aren't gonna hire you, which is unfortunate, but that's just the reality. So the reality is you ask these questions and you figure out what your work area is like, and you might have to go and work in one of those places, but at least you know ahead of time that I
Right.
have to put my big girl panties on or my big boy panties on every day when
Mm.
I go into work and say, "I'm gonna be that one person.
Every
Don't
time.
call me on my day off. I'm
Mm.
not coming in. Don't ask me to work overtime. I'm not doing it. I am not taking more than this amount of patients," right?
Right.
You're gonna have to be that sassy, mean person that's like, "No, I'm not doing it." And everyone else is gonna hate you.
Mhm.
Just be ready for it. They're all gonna hate you. They're all gonna give you trash about it. They're all gonna throw you down the road. But guess what? You have to do what is safe for you.
Yep.
What
Yep.
is safe for you. Advocating for yourself to be able to be a safe and prudent nurse. There is nothing wrong with that. If you are
Absolutely.
advocating for yourself to be a good nurse, guess what you're advocating for? The ability to provide safe and quality care to your patients.